Hi, Dr. Vaxas here. Today I would like to address a frequently asked question. Why acid-reducing drug failed me? Often I receive email from patients telling me that they started on acid-reducing medication. It's worked for a couple days and it stopped working. Then they have to increase the dose. It's worked for a few days and then it stopped working again. So they have to switch to other medication. They never been satisfied with the medications. In order to explain you why it happened, I have to clarify 2 points. Point number 1, acid reflux is a symptom and could be created by different causes. Second is how acid-reducing medication is working. I already talked in one of my videos, and you please go ahead here on YouTube and watch it. PPI drugs, they will decrease production by irreversibly blocking proton pump. So now let's go to the point number 1. Acid reflux is a symptom. It could be created by many different causes. Let me give you a parallel example. For example, I have a blister. Blister could be created by rubbing the area vigorously, similar to the way when we buy shoes that one size too small, you go and run and you will have a blister physically created. Then suppose you drop an acid and create a blister, acid-induced blister. Or I was working on the kitchen, the pot was boiling, I lifted the top and created a heat blister. One blister, 3 possible causes. But what is very important for you to understand here, that the different treatment will be for each cause. If that's a mechanical, the shoes are too small, go buy new shoes. If that's the chemical burn, I have to run and clean the skin from the chemical. If that's a heat burn, immediately apply ice on that area. Similar should be applied into understanding of acid reflux. I identified about 8 common causes for acid reflux. Only one of them is when patient has increased production of hydrochloric acid. So let's see your patient who actually, this is the normal acid production. You have increased production of hydrochloric acid. You get the medication that will reduce acid production. You will decrease acidity in the stomach. Drug works perfectly for you. How about if you are a patient who has a normal level of hydrochloric acid or underproducing? When you underproduce hydrochloric acid, duodenal valve stays closed, stomach keeps churning until the whole food and digested there, and it will stay there for longer period of time. Low esophageal sphincter is a muscle. It will be closed, but eventually it will give up and will say, I cannot stay closed anymore, and it will open a little bit, and the food and acid will go through that, and it will create acidity. So if you have low acid production, and then you will add more acid-reducing drug, you will drive acidity further down. You only will exacerbate the problem. So that's why it is so important to understand that you have several causes. You need a different treatment for every single one of them. That's why the drug is not going to work for every single one of them. You identify your cause and you address this individual cause. Thank you very much for watching. See my other YouTube video. Subscribe to my channel.